I'm dying, but I don't have health insurance. What should I do? Well, let's talk about some alternatives because health insurance can be expensive if you don't have it through your job or through your parents. But how expensive can it be? Well, let's talk about that. So, there's this website called healthcare.gov that's sponsored by the government, and you can get an estimate of the prices of 2023 health plans. So, let's say that I live in this zip code in Broward County, Florida. Push continue. Tell us about you and your household. So let's just start that. If you don't have a health insurance plan, you can just skip this part. So just skip it. And then this is just gonna be for me. Continue. My age, like say I'm 23, and then I'm a male. And then select any of these that apply to you. So select them if they apply to you. Then push continue, and then push confirm, and then estimate your income. So let's say if $65,000, you can put $40,000, whatever. Just estimate it, push continue, and then because of the income, I'm not eligible for a premium tax credit. If I made less income, I might be eligible for a premium tax credit. But let's say I'm not eligible, I can see the full price plans now. And so you can get some quick definitions by hovering above the pop-up icons, filter the plans, select the plans to compare, push next, and then you can see, wow, this is super kind of expensive. So a bronze plan has a lower premium, so you pay less every month, but your deductible is higher, so you have to pay more before the plan starts paying you anything. So if we just click see all plans, we can just look over this information. So this one is the cheapest plan. It has the lowest premium of $213.69, which I think is still a lot of money, but it has a very high deductible of $9,100. So hovering above this icon here, you can see that a deductible is the amount you pay for covered services before the plan starts to pay. So you have to pay out of pocket $9,100 first, and then your plan will kick in. So if you spend $10,000 in the emergency room, well, you have to pay the first $9,100, and then for here, emergency room care, there's no charge after that. So that's really, really expensive to me. This isn't a great plan anyway because of the high deductible. Some better plans would have a lower deductible of maybe like $1,000 or maybe $0, but that means a higher monthly premium. Regardless to say, healthcare can be really, really expensive. Some alternatives is to use GoodRx. So if you need a specific kind of medication, you can type it in. For example, you might have asthma. So I'm just gonna type that in and I can see all the drugs for asthma. And then I'm just gonna go to the very bottom. So these are some possible medications you might need for asthma. Well, I'm gonna click on this one. It begins at $16.79. So given their discounts and which pharmacy that you go to, you can get a lower priced offer. So instead of $45 retail, you only have to pay $14.18. Or if you go to Walmart, it's $8.25. So this is a good way to get medications if you need it on discount because you don't have a health insurance plan. Furthermore, I'm not sponsored by GoodRx. It's just a cool company because you can make an account for free and get discounts on medications. Moreover, they have a GoodRx Care service, so that's a monthly cost. It gives you affordable care anytime, anywhere. Start your personalized appointment with one of your licensed healthcare providers via text, phone, or video today. So online visits start at $19 with a gold membership. So what is a gold membership? Well, we can click on it and we can see that you can try it for 30 days for free, and it's $9.99 per month for individual members. And it gives you savings and lots of other discounts. So if you happen to only want to pay $19 per month instead of the $200 per month, you can use GoodRx Care. So by paying $9.99 per month, you have the option to see physicians and doctors at $19 per visit. So let's say you want to see the doctor 2 times, 19 times 2 is $38 plus that $9.99 per month fee. And then if you don't want to see any doctors, it's just the $9.99 per month. And anytime you need to see the doctor, you can pay that $19 per visit fee, which is basically kind of the same as a copay, honestly, and it's much cheaper. And this way you can get the prescription drugs that you need prescribed by an actual physician, an actual doctor. Good option, right? You won't be able to meet in person for a physician, but you can do online visits for urinary tract infection, erectile dysfunction, hair loss, birth control, and so on and so forth. And they cost $19 if you want to see a physician online. But what if you need to see a doctor in person rather than just online? Well, there's an option for you too. In the description below is a website to free clinics that you can see in person, along with many other resources. So let's delve into that one. So just click through it, just search it up by zip code where you need to meet the doctor, and then search it up. And if you scroll down, you can see 10 clinics in or near your zip code, and so you can call them, schedule an appointment, and see a doctor in person. And you can also ask about the cost. These are very low cost options, probably even free given the name of the website. You can try it out and see if you need to visit a doctor in person. Another option to look into is hospital accident insurance plans. So they will cover you in the case you go to the hospital or have a physical injury. They do not cover like mental or health sickness issues, just physical injuries. So this is a hospital accident insurance plan offered by my credit union. It gives me $1,800 a day if I go to the intensive care unit, $900 a day if I go to the hospital, and then $450 per accident if I go to the emergency room. And it costs me $17.65 per month, which I think is a great deal for in case I ever have an accident that would require me to go to the hospital. But do realize that this only covers physical injuries, and it might not cover the entire amount of the ER room or the health service. But it's a good option for those not trying to spend $200 a month, but just $17.65 per month. And then for your family, this is $29.95. You can also just Google hospital accident insurance plan so that you can get an idea of what is available in your area. I gave 2 examples here if you want to compare and look. So for this one, I'm not sponsored by them. I also only found this out about 5 minutes ago. So just type in the website or copy and paste. I'm 23 and I'm based in Florida. It gives you accident insurance coverage starting at $5 a month. Click get started. And then this is just for me. And then I can choose what I'm looking for, the affordable price option. And then I can see that this plan is $4.19 per month, and it gives me $250 in emergency transportation and these other things here. And I can scroll down and look at more details. Or I can view all the plans, click that option, and then see the different comparisons I can make. So if I want more coverage, I can pay more per month, and that's how that goes. But you can just Google and look for other options, maybe call up some of the hotlines that they give you so you can compare your options. And then this is another one I found about 5 minutes ago while I was Googling. There you go. It gives you another plan that you can go through. So that's just another option. I personally just don't want to spend hundreds of dollars on health insurance when I think I don't need it. I might need it, but for me, I would rather just save that money and have that in a savings account and only target it towards health services in the future when I might need it. Maybe if I had more health issues or needed more medicines or it was cheaper through my job or something, then I would consider having health insurance. But at the moment, I like these alternatives, and this is what I'm using to save on health insurance. So I realize that this is more like part 1 of the alternatives to health insurance because there are government subsidies that you can apply for as well. You've probably heard of it, called Obamacare or the health insurance marketplace, that can lower your health insurance cost. I will touch on that on the next video, so make sure to watch that if you want to get health insurance but at a discount. But you have to have a certain income or lower in order to qualify. Moreover, you can have a healthy lifestyle, exercise 3 to 4 times a week, eat healthy and sleep on a regular schedule. Those will definitely be preventative measures so that you spend less money on health insurance and stay healthier for longer. So if you want to really save money on health insurance, exercise, eat right, and sleep right. It's good for you and saves you money in your pocket, which is what we want. Please also give me suggestions in the comments below for more health insurance hacks and tricks and other ways to save on health services, because I would really appreciate it, and so will a lot of other people. I want to say thanks for watching. All the links and resources are in the description below. Thanks for watching. This is That Money Guy. Like, subscribe, comment, and all that jazz. Thank you. And stay tuned for the next video on more health insurance hacks.